Hello everyone. This is Sneha Ghosh,
and Promita Dash from India.
and we are here to present our project that assesses the happiness factor of online social network users based on the posts made by them across a social media platform. According to the World Health Organization, depression is a common illness worldwide that affects around 5% of adults and often remains undiagnosed. When recurrent and with moderate or severe intensity, depression become a serious health condition and hamper the usual way of living. The persistent problem has been a lack of resources, lack of trained healthcare providers, and social stigma associated with mental disorders. In countries of various income levels, people who experience depression are often not correctly diagnosed. A substantial gap is observed between the caregivers and caretakers. It has been concluded by various researchers that people tend to express their emotions online through tweets, posts, and usage of hashtags and captions. When the world went to a state of lockdown due to the COVID 19 outbreak and most people got confined to a single place, people started using online social networks all the more as a way of staying connected by posting about their daily activities and sharing their feelings with their online friends. Concerns about mental health issues have been spiking for quite some time, and more than often, people are reluctant to seek help face to face, which makes it harder for friends and family to detect any anomaly in mental state. Whereas users on social media can talk about their mental health state with their online friends with the choice of not revealing their real identities and thus being devoid of any judgments, but at the same time hoping to receive help. This is where our work is important and relevant. We are finding out the happiness factor of a social media user, which is an unbiased and confidential rating of the depression level of that user. HF will help an OSN provider take the necessary steps to improve the user's state of mind.
Now, our project has been divided into three phases. In phase 1, multiple datasets consisting of tweets from different users and their labels are pre-processed and are used to train machine learning and deep learning models to classify tweets as depressed or not depressed. Further, we are working on exploring more classifiers of machine learning models such as support vector machine, decision tree, random forest, and deep learning models such as LSTM and bidirectional LSTM to determine which model works best. Currently, we are labeling the tweets in a binary format, namely 0 and 1. Later on, we have plans to evaluate those with respect to a broader range. That particular model will be used to label the tweets and find the happiness factor of each user. Currently, we are distributing existing datasets among users to find the HF. Due to Facebook and Twitter's privacy policies, it is hard to get data. Thus, in phase 2, data will be scraped from Twippy to get a more realistic idea about the current mental health state of Twitter users. Further, we will be calculating the happiness factor of a specific user by finding the probability of a depressed posts made compared to the total number of posts made by that user in a given time period. The novelty of our work will be shown in phase 3, where we not only find out the mental health condition of each user, but use the information to help the user by suggesting them respective measures, including mental health helplines, suggesting verified depression diagnostic centers near their location, showing happy quotes and memories, and the like. Taking into the consideration that the human mind is complex and unique, we will also try to detect sarcasm in our users' posts and also the time gaps between posts to make our model more effective, practical, and helpful. In our project here, we have imported the required packages and our dataset. Then the data is cleansed, tokenized, and split into training and testing datasets. Now we train the model, the multinomial NB model here, when we get an accuracy of 79%. As you all can see, the model is predicting the labels correctly here. We are thankful to both our institutions and Smita Ghosh, our faculty advisor, and also the IEEE Rising Stars Conference Committee for providing us with this opportunity.